I'm a dentist, and I'm going to let you in on a little secret one that might get me a few sideways glances at my next dental conference. For most people, gum disease is completely preventable. And you can do it at home. Honestly, I'm tired of seeing people come into my office with bleeding gums and serious problems, facing treatments that are expensive and invasive, when it all could have been avoided. The truth is, you have the power to stop plaque and gingivitis for good. In this video, I'm not just going to tell you to brush more. I'm going to give you the complete playbook, the pro-level secrets that will save your smile. Every single day, I see it, people sitting in my chair with gums that are red, puffy, and bleed when they are touched. That's a condition called gingivitis, and it's the very first stage of gum disease. What's the culprit? A sticky, invisible film of bacteria called plaque that's always trying to set up camp on your teeth. If you let that plaque hang around for too long, it hardens into tartar. Think of it like cement, which you absolutely cannot brush away on your own. And that's where the real trouble begins. What starts as simple gingivitis, which, by the way, is completely reversible, can spiral into periodontitis. This is a much bigger deal. It's a serious infection where your gums literally start pulling away from your teeth, creating these deep pockets where even more bacteria can hide and party. This infection doesn't just stay in your gums. It attacks the very bone that holds your teeth in place. Your teeth can get loose, and in the worst cases, they can actually fall out. But here's the good news, it doesn't have to get that far. You can stop this runaway train in its tracks. And it all comes down to what you do at home, every day. 1. Pillar number 1, the truth about brushing. Okay, first things first, brushing. I can almost hear you thinking, Doc, I already brush my teeth twice a day. I hear you, but here's the secret, it's not just that you brush, it's how you brush. Most people attack their teeth with way too much force, scrubbing like they are trying to get a stain out of the carpet. This actually hurts you more than it helps, damaging your gums and wearing away your enamel. The goal isn't to scrub, it's to gently outsmart that soft, sticky plaque. First, you need the right tool. Do me a favor and throw out your medium and hard bristled toothbrushes. You should only ever use a brush with soft or extra soft bristles. An electric toothbrush with a rotating head can be a fantastic plaque remover. But a good old-fashioned manual brush is perfectly fine if your technique is on point. And please, replace your brush every 3 to 4 months or as soon as the bristles start to look tired and frayed. A worn-out brush just isn't doing the job. Now, let's talk technique, because this is everything. You want to angle your toothbrush at 45 degrees, right where your teeth and gums meet. That little crevice is plaque's favorite hiding spot. Instead of that aggressive back and forth soaring motion, use gentle, short, circular strokes. Think of it as massaging your gums, not punishing them. You need to do this for at least 2 full minutes. A good trick is to divide your mouth into 4 sections: upper right, upper left, lower right, lower left, and spend 30 seconds on each. And be thorough. Clean every surface, the outside by your cheek, the inside by your tongue, and the tops where you chew. To get behind your front teeth, turn the brush vertically and use little up and down strokes with the tip. Here's a pro tip: most of us brush on autopilot, which means we miss the same spots over and over. Try starting in a different part of your mouth each time to break the habit, and give every tooth the attention it deserves. Oh, and don't forget to give your tongue a gentle brush. A huge amount of bad breath-causing bacteria lives there. 2. Pillar number 2, the 40% you're missing, flossing. Think about this, if you're only brushing, you're only cleaning about 60% of your teeth. The other 40% is hiding between them, in places where your toothbrush bristles just can't go. This is where plaque has its secret parties, hardens into tartar, and causes cavities and gingivitis. That's why flossing isn't an optional bonus, it's non-negotiable. I know. A lot of people hate flossing. It feels awkward, and if your gums are already inflamed, it might make them bleed a little at first. Don't panic. That bleeding is a sign that your gums need the attention. Stick with it for a few days, and as they get healthier, the bleeding will stop. Technique is key here, too. Grab about 18 inches of floss, roughly the length from your fingertips to your elbow. Wrap most of it around one middle finger, and just a little bit around the other, leaving an inch or two to work with. Gently guide the floss between two teeth. Now, here's the most important part: don't just snap it up and down. You need to curve the floss into a C shape against the side of one tooth, and glide it gently up and down, going slightly below the gum line. You're trying to wipe the surface clean. Then, hug the other tooth and do the same thing. Use a fresh section of floss for every gap so you're not just moving plaque from one spot to another. If you really can't get the hang of string floss, don't just give up. There are some amazing alternatives. Water flossers use a targeted stream of water to flush out plaque and food from between your teeth and below the gums. They are a game changer, especially if you have braces or bridges. There are also tiny little interdental brushes that look like mini pipe cleaners and work wonders for bigger spaces. The best tool is the one you'll actually use every day. Cleaning between your teeth isn't extra credit, it's half the battle. 3. Pillar number 3, the professional secrets. Alright, you've mastered brushing and flossing. Now let's level up with a few pro secrets that can take your oral health from good to truly great. These are the little tweaks that make a huge difference. First, after you brush with fluoride toothpaste, spit out the extra foam. But don't rinse with water. I see people do this constantly, but you're washing away all the good stuff. Fluoride needs time to sit on your teeth to work its magic, strengthening your enamel and making it tougher against acid attacks from bacteria. Just spit, don't rinse. You're leaving a protective shield on your teeth. It's a simple change with a massive payoff. Second, let's talk about timing, especially after eating. If you've just had something acidic like orange juice, soda, or even wine, wait at least 30 minutes before you brush. Acidic foods temporarily soften your enamel. And if you brush right away, you're literally scrubbing away a microscopic layer of your tooth. Rinsing with plain water right after you eat or drink something acidic is a great way to neutralize things while you wait. Chewing sugar-free gum is another great option, as it gets your saliva flowing, which is your body's natural acid-fighting superpower. Third, consider an antibacterial mouthwash. Now, this is not a substitute for brushing and flossing, but it can be a great teammate. A good therapeutic mouthwash can help reduce the overall bacterial population in your mouth. Some studies have even shown that rinses with ingredients like lemongrass oil or aloe vera can be quite effective against plaque and gingivitis. Even a simple salt water rinse can be fantastic for soothing inflamed gums and helping them heal. 4. When at-home care isn't enough, professional treatments. The daily routine we've talked about will absolutely prevent and even reverse early-stage gingivitis. But what happens if plaque has already hardened into that cement-like tartar? Or if the disease has progressed to periodontitis? At that point, at-home care isn't enough to fix the problem. That's when you need to call in a professional. The first step is usually a deep cleaning, which we dentists call scaling and root planing. This isn't your average cleaning. Scaling is where we carefully remove all the plaque and tartar from both above and below your gum line. Then, root planing involves smoothing out the surfaces of your tooth roots. This makes it harder for bacteria to stick in the future and helps your gums heal and reattach snugly to your teeth, closing up those dangerous pockets. We typically use local anesthetic for this, so you'll be perfectly comfortable. In some situations, if an infection is particularly stubborn, we might place a tiny antibiotic gel or chip directly into the gum pocket. This releases medication over several days to eliminate any bacteria that the deep cleaning couldn't reach. For more advanced cases where bone has been lost, surgery might be the best option, and it's not as frightening as it sounds. One common procedure is called flap surgery, where we gently lift the gums to get direct access to clean the infected root surfaces thoroughly. If bone has been destroyed, we can sometimes perform a bone graft to help your body regenerate what was lost and give your teeth better support. Similarly, gum grafts can be used to cover exposed roots, which protects them from decay and reduces sensitivity. These treatments work incredibly well. But really, the goal of this video is to give you the tools so you never need them. So, there you have it. You are now equipped with the knowledge to take full control of your oral health. You know that beating plaque and gingivitis isn't about some magic bullet. It's about building a consistent routine with the right techniques. You know the truth about brushing, why you can't skip flossing, the little secrets that give you a huge advantage, and when it's time to call for backup. Honestly, you now know more than 90% of the population about how to protect your smile for life. The power is in your hands. Gingivitis is preventable, it's reversible. And even if you're seeing the first signs, you can start turning things around today. To make this super easy for you, I've put this entire routine into a simple, one-page checklist. It covers everything we talked about, from the 45-degree angle to the spit denturance rule. You can download it for free at the link in the description. Print it out, stick it on your bathroom mirror, and use it as a daily reminder of the commitment you're making to a healthier you. If you found this guide helpful, do me a favor and subscribe. And turn on notifications for more pro tips that can save you time, money, and your smile. Thanks for watching, and here's to your healthy gums.